Today, we have two great individuals here with us, two powerhouses in our state. So we're excited to have them here. But I'm going to first introduce Brandon George. He is the Vice President of Mental Health America of Indiana, the Director of Indiana Addictions Issues Coalition, and anybody that was on the call with me yesterday. Now, you know, I was a little tongue-tied on that. Brandon George is the Vice President for Recovery, Advocacy, and Programs for Mental Health America, Indiana, and the Director of Indiana Addictions Issues Coalition, with advocates for recovery through public policy and education. As a person in long-term recovery, Brandon dedicates his time personally and professionally to fighting addictions and promoting recovery. Brandon has been used as a consultant for SAMHSA, Opioids Response Network, the Bureau of Justice Assistance, and is a contributor to Harvard's Law blog. He served as a trusted advisor to the National Judicial Opioid Task Force, on Leaders Council for Legal Services Corporation, LSC, and drug control policy regarding addiction workforce issues and recovery messaging. Welcome, Brandon George. Thank you for joining us.
Thank you, Kimbra. And if I would have known you were going to read that thing, I would have sent it tomorrow or something like that. So thank you. It's unfortunately, there's just so much work that needs to be done that, there's a lot of opportunity to work in this space. So I appreciate you all having me today, and just really want to take a minute to say thanks to everybody on this call. I know a lot of you folks are doing enormous amounts of work in your community on this topic, and are the leaders in making sure that there's amazing things going on in each of your communities. So thank you. I appreciate that deeply. And so a couple things I want to go over before giving the floor to who everybody showed up to see today, Doug. I want to talk a little bit about a couple projects we have going on, specifically the Indiana Recovery Network's Regional Recovery Hubs project, and then another project called Journey Home that really focuses on the transition of folks from in their county jail back into their community. And so one of the things that I guess a little bit of a silver lining as a result of COVID-19 is that the state and our communities and all our partners really had to think of innovative ways to start reaching people with substance use disorder. And one of the things that we did right when COVID hit was we realized that all of these treatment providers and other folks were really trying to switch everything to digital and online. And a lot of people were struggling to make connection. And so the governor's office, the Division of Mental Health and Addiction got together some community partners and tried to figure out ways to reach some of these folks. And out of that was born the Regional Recovery Hubs project. And the goal of it really was to mobilize the peer workforce. And so, as most of you know, we've already got a workforce shortage in Indiana. And so we were already dealing with that. We started dealing with COVID and people transitioning their care. It became even more difficult. And so one of the thoughts was if we could use peers to fill in some of the gray area, that would be of huge benefit. They are resource brokers by nature. That's what they do. Then they also are people with lived experience who have navigated the system before. And so what we did was started reaching out to a variety of recovery organizations through the Indiana Recovery Network and found some amazing partners to expand their peer services. For anybody that is unaware of what peer support are, recovery coaches, certified recovery specialists, got a slide here that explains. I'm not going to go through all of it. We'll send these slides out afterwards, but people with lived experience from addiction that have some specific training about different recovery pathways and our systems as a whole. And so recovery hubs can be a variety of things. They can be recovery community organizations. They could be recovery engagement centers. They could be drop-in centers, recovery cafes. Several of the LCCs have added recovery as a main focus to what they do, and they also have, have become recovery community organizations in their own or coalitions that also serve this role. And then just told you the purpose of it. Another thing we wanted to be able to do that we'll talk about is we wanted to make sure that folks had easy access points to recovery support services. So we'll talk a little bit more about that later. So mobilize the peer workforce, really make sure that we're focused on super marginalized populations, which involves rural areas, also criminal justice involved, et cetera. And one of the things, we talk a lot about meeting people where they're at. And then we turn around and say, as long as you show up at my building with a very specific type of insurance, in a very specific way. And so we really wanted to try to, put our money where our mouth is when it comes to meeting people where they're at. And so the recovery hubs really serve as a community-based model that are not tied to an individual treatment center, an individual court system, an individual jail, et cetera. They operate independently in the gray area, which means their mission is really true to helping individuals around recovery. The jail has a mission to keep our community safe, right? To house people, and different organizations have different North Stars. And with these recovery hubs, they're really able to stay true to a mission of being responsible to the recovery community. And so here's a map. We started off this project about 18 months ago with 12 recovery hubs. It went up to 16 by the end of the first year. And I'm really excited to announce that we just onboarded our 19th and 20th recovery hub over the last couple months. And they are just like Indiana counties. They come in all shapes, sizes, flavors, et cetera. We believe recovery is local, and what's going on in Jay County is going to be different than what's going on in Scott County, which is going to be different than what's going on in Marion County. And so here's a map of the different hubs that serve the different counties. There's a couple different ways to connect. Again, we wanted to keep this super simple. One, go to indianarecoverynetwork.org. As you can see right there, there is a connect to a peer button. You can connect to that. Peer will get right back with you and get you either triage the needs that the person needs on the spot, or get them connected to the local recovery hub if they want ongoing support. And then maybe one of the things I was most excited about during this process specifically, and again, one of the benefits of working with the governor's office and DMHA, we were able to really collaborate with other programs. And so we were able to collaborate with the state's 211 program. I'm sure you guys know, you can pick up the phone, call 211 to get connected to a variety of social services. And so we have an extension on 211. You call 211 for the SUD area and you hit option 6 and it connects you with the peer support. Specifically, one of our peer supports from the Recovery Hubs project. And then again, similar to what I said with doing it online, they may help connect somebody to treatments or recovery housing or any other resource on the spot, that kind of triage need. But if it's somebody that is from Maryville that wants to have an ongoing recovery coach, then we'll reach out to our partners, Liberty House, that are up in the Maryville-Gary area. We'll do a warm handoff. And that way we can get that person connected with their local recovery community, not some random person from Indy answering the call. It's available 7 days a week, 9 a.m. to 8 p.m. That is going to change, we're hoping. We think next year that we're going to be able to do this 24 hours a day. The other good, neat thing about this is it connects with the Be Well crisis call line. And so if somebody calls and it's outside of the scope of what a recovery coach does, if somebody's really in crisis mode, we also have the ability to warm hand off to the Be Well crisis line. So as mentioned, we cover all 92 counties with the Recovery Hubs project. We have provided over 51,000 services in the first 18 months of this project, 51,000 services. I think the number is about 20,000 individuals, some of them multiple services, so that number is a little bit different. And then as mentioned, this year we added 6 recovery hubs. And something I'm really proud of is that we included 2 harm reduction focused organizations and 2 BIPOC focused organizations. We really need to make sure that we focus on the full continuum. And look, nobody knows that better than the LCCs, right? You guys do from prevention all the way through. And so I think recovery and harm reduction has been something that's been generally left out of the conversation until recently. And I'm really glad to see a lot of the LCCs embrace and make sure that all of the ground's being covered. Just quickly, we've also worked with Overdose Lifeline and their project to get naloxone out. 14 of our 19 hubs are now naloxone distributors as well. The goal is to have all of them, but we've also helped out put dozens of naloxone boxes. And so Heather Rodriguez is the manager of the Indiana Recovery Network. We'll put her contact information in the chat box in case anybody has more questions about that, or feel free to reach out to me. And then just briefly, because the LCCs are so plugged in at a community level, and you guys also are connected to the criminal justice system, often having people that sit on your boards and on your coalitions that represent the sheriff's office and the court system, is I want to talk a little bit about a project called Journey Home. And again, Journey Home is really focused on trying to improve the connection, people leaving the county jail back into the community. This is really truly a core group of a variety of disciplines and leaders throughout the state. Again, Division of Mental Health and Addiction, ICJI is part of that. Division of Mental Health and Addiction, the governor's office, the Indiana Supreme Court, the Sheriff's Association, and on and on and on. A bunch of folks trying to figure out a better way to improve this. Problem statement: individuals with SUD leaving county jails are at risk of increased overdose. We know that. Recidivism and inflicting collateral trauma due to a lack of individual empowerment. And coordinated array of clinical and social services. Even jails that do a really, really good job of helping people, which that's not their area of expertise, often stops when people leave, and that we need to improve that coordination. So that's one of the main goals of the project. We're piloting it in 3 counties: Boone County, with Sheriff Nielsen, Davies County, and Delaware County as well. We're trying to pick people with different resource levels in the SUD space specifically. And the goal of it is to help individuals with SUD understand the services, align priorities and strategies, reduce recidivism, and really try to, again, we're trying to put recovery coaches and paramedicine groups with individuals in jail from the start of the process, and can help walk them along that journey back into the community. And so my reason for saying this is that if you are in a community and this is an area of focus for you, reach out to us. Let us know. We'd love to have a conversation. I think the goal will be, once these pilots are up and going, to expand this for any community that wants to make this a priority. To do so, we've got to have buy-in from the local community. There has to be some MOUs in place between local providers. There's got to be a belief in peer support and recovery supports in the community. And then we can help create a roadmap so that, we can stop losing people that are leaving jail to overdose. I mean, we know that, again, 120 times more likely to die is an astounding number. And if we know that's a problem, we really should be taking every precaution to make sure that we help folks that are in that big of a risk category. And so I get to do a lot of work in Indiana, and I also do a fair amount of work over the country. And one of the things that I run into consistently is folks telling me how lucky I am to live in a state that gets support from its top government officials and the top leaders in the state. And I really see people bang their head against the wall. I see people that are unable to, their state does not have Medicaid that pays for treatment. They don't believe in naloxone or medication. They don't believe in prevention. There's a variety of problems that a lot of people in other states run into that we thankfully do not. We have enough barriers and just trying to fix the problems to help overcome ideological ones. And it's been really, really clear since Governor Holcomb came in office that this has been a priority. Created what is now known as the drug czar position, one of his first acts of being in office. And I'm really honored to introduce Doug Hunsinger, who is the executive director of drug prevention, treatment, and enforcement, and the chair of the Indiana Commission to Combat Drug Abuse, to the call today. It's been an unbelievable partner, and I really, we are tremendously lucky to be able to work with and coordinate all of the evidence-based practices they believe in: naloxone, medication, peer support, on and on and on. And so I'm excited to hear an update from him on the local, the most up-to-date things coming out of his office. So Doug, the floor is yours.
Well, thank you, Brandon, for the introduction, and to the Indiana Coalition Network for inviting me to be part of your monthly webinar. Before we get started, I just want to take a moment to thank everyone for your tireless efforts this recovery month to celebrate Hoosiers who are in recovery and the individuals who help make recovery possible. And while I haven't been able to make all the events, you have successfully turned Indiana purple for the month of September. So thank you for that. I do have quite a bit of information. I'm going to try to go very quickly. We have sort of modified this presentation to one that's a little bit longer, but I want to make sure that we have plenty of time to answer questions that you have. So as everyone I am sure is aware, on day one of his administration, Governor Holcomb made combating the drug epidemic a top priority and called for that all hands on deck approach to help in this fight. Since then, we've built a statewide infrastructure that cares for the whole patient. It supports them not just for the next 6 months or the next year, but really focused on supporting them throughout their lifelong recovery journey. And while COVID-19 has definitely caused us to shift our course, our mission remains the same. I want to quickly take you back to pre-COVID. We were on the right track. Overdoses were down 3 times out of the national average. Our prescribing rates were down 23.5%. And since 2017, we have increased residential treatment beds capacity by 213%. And the most important thing that happened was the Medicaid waiver. As many of you are very aware, prior to 2018, block grant funding was the only source of payment for uninsured individuals to receive treatment. And since then, over 300,000 Hoosier Medicaid members have taken advantage of the expanded access to SUD treatment, which equates to about $656 million that we've spent on treatment since January of 2018. A couple things. We have 4 high key level impact indicators that we're always tracking. One of those is the number of persons with overdoses that are admitted to Indiana hospitals, deaths from overdoses, opioid prescribing rates, and also the number of babies who are born with neonatal abstinence syndrome. We've seen a nearly 50% increase in overdoses in our emergency departments since 2020 compared to 2019. And already this year, we're seeing a 21% increase from the year prior. So this is not getting better. And a lot of that, while we've lost a lot of connection due to COVID, fentanyl is really driving our overdoses in the emergency departments, our naloxone distribution, and also overdose deaths. Fentanyl is present in almost all of those cases. As we look, CDC came out, overdose deaths are up 33% in 2020 over 2019, and Indiana is just 3% higher than the national average. But we're not alone. All across this country, we are seeing an increase. An example, Kentucky saw a 49% increase from 2019. So we've got a lot of work to do. And we're still seeing those increases as we look at our provisional data coming in. Neonatal abstinence syndrome, this is something that we have put a lot of effort behind. Indiana started testing for drug-exposed babies in 2016. We have now expanded that to 56 hospitals across the state, and 20.2% of newborns delivered at our participating hospitals in 2020 tested positive for exposure in umbilical cords. We have a number of programs to really combat this. Volunteers of America has a number of different facilities around the state where women are able to stay with their child. We know we get better outcomes when women can stay with their kids. VOA also allows for them to bring other kids that are under the age of 3. The Community Health Network Choice Program is one that started at Community Hospital East. It is also expanding into Anderson and Kokomo. And this is really, they spend a lot of time, they induce these women into Suboxone if clinically indicated. But while they're doing that induction in the hospital, They spend the time to talk to the woman, find out what her needs are, and then their navigators work to break down those barriers, whether it's transportation or food security, or even housing. A lot of these women are not in positive places. With that, the Indiana Family and Social Services Administration has launched their pregnancy promise. And this is a program for our Medicaid members, and it pairs them with navigators at our MCEs. And this, again, we know that if we offer services to pregnant women, that they have healthier babies. It reduces NICU stays. It reduces the cost there. So really looking at how do we have healthy moms and healthy babies. When we first began to see naloxone administrations by EMS right at the beginning of COVID, we acted. We distributed over 55,000 doses of naloxone in 2020. Already this year, we have distributed 41,000 doses. And in August, we announced a $1.3 million investment, which is another 35,000 doses of naloxone. It's another 215 nalox boxes. These are boxes like you see in the photo here, really designed to be zero barrier access to naloxone. These are placed in public spaces, and anyone can go and retrieve naloxone. We're going to have 430 of these boxes around the state. They're on everything from libraries to in Bicknell, Indiana. It's on the side of a bar. They had a number of overdose events in that space, and that's where the community decided that box needed to be. So we also, during COVID, worked to put naloxone in the hand of every DOC offender as they exited the Department of Correction. And in August, 162 DOC inmates took home naloxone upon their release. So this really goes to our goal of keeping people alive. We can't move people into treatment. We can't move people into recovery if they're not alive. So harm reduction is vitally important, especially right now with the lingering impact of COVID and the fentanyl that is in the market. I want to talk briefly about our crisis counseling helpline that Brandon briefly mentioned. This is they fielded 20,000 calls since July of 2020. And 53% of those callers had pre-existing trauma and or substance use mental health problems and were referred to treatment. Another really great thing that really begins to tie a lot of this work together is 988. 988 is a response to federal legislation around having a mental health crisis line. 211, 988, 911, we're really working to tie all those pieces together to ensure that when someone is having a mental health crisis, if we call 988, that we're leveraging the systems that we already have in place, be that the emergency services available through 911 or the social services that are available through 211. We're really tying those together, looking at how we respond to mental health calls. There's a group at the Division of Mental Health and Addiction that have been working on this for the last year, and I believe implementation will be in second quarter of next year. As Brandon mentioned, the recovery hubs, this is really exciting. This is a program that was really taken a while to get off the ground prior to COVID, but COVID really saw the need for this, for these recovery hubs, for this local connection to recovery supports. And I cannot say enough about Brandon and his team and how quickly they got this off the ground, how they got people together to use common language, common processes, common procedures. This is a really exciting, we are leading the nation in our recovery hubs. And so can't say enough about the work that has been going on there. Briefly want to touch on our funding streams. Over the next year, we're going to see an influx of funding that's coming to the state. And this is critical as we look to build bridges throughout our existing infrastructure. It's important to understand that almost all of these funds are one-time funds, and our goal is to really ensure that we're maximizing their use, that we're investing in systems, that we're investing in infrastructure, and that we're being careful not to create funding cliffs. The worst thing we could do is create new programs with no ability to sustain them once this funding ends. And so the Federal Consolidated Omnibus Appropriations Act, as many people will refer to this as the Stimulus One, that has $30 million going to substance abuse prevention block grant and $15 million going to our community mental health block grant. DMHA is really using a lot of these funds to sustain a number of programs. We have submitted our plans. I believe they have received final approval from SAMHSA, and a lot of that is going to fund the programs that we have mentioned, our recovery hubs, our 211, the integration with 988, all of that. The American Rescue Plan Act, also what many people refer to as Stimulus 2. That's $26 million to the Substance Abuse Prevention Block Grant Fund, and then $25.6 to the Mental Health Block Grant. We are still waiting on the Department of Treasury to finalize those. We have put together a number of plans around those, which I'll get into a little later, but we don't have final approval. And also as part of this rescue plan, the state budget in this last legislative session, the legislature appropriated $100 million over the next two state fiscal years for mental health and addiction services. And then finally is the funding coming from opioid litigation settlements. Indiana's share is likely to be about $250 million. It could take about 18 years for that funding to be doled out. There's an incentive structure. We're probably not likely to meet that incentive structure because of some timing issues in the Attorney General's office. Previous Attorney General waited a little long to file those lawsuits, and a number of communities decided to file on their own. And then this Attorney General worked with the legislature to create a funding structure and a settlement fund. And so a number of communities around our state, there's about 74 local units of government that have filed their own litigation, and they have chosen to opt out of this, which is fine. That is absolutely their right to do. But the settlement structure that Indiana has created is 15% of the fund will go to local units of government, 15% goes to the state, and then 70%, half of that funding goes to local units of government to be put towards abatement. And the other half is for FSSA to administer regionally to the local units of government. So a lot of funding that will be flowing to our local units of government. There are a number of restrictions around how this funding can be used. It really flows a lot with some of the SAMHSA regulations that we have. So it shouldn't be really new to a lot of our local units of government. But one thing is prevention is really wide open in this space. It requires that evidence-based prevention practices be used, but it's not just opioid prevention. It is large-scale upstream prevention that is able to be funded. So that's really exciting. New programs. So what are we going to do with all this money? So one, we're going to invest in evidence-based practices that treat the whole individual, not just during their treatment and early recovery, but throughout their lifetime. We're going to emphasize recovery supports. We are going to seek out the forgotten corners and underserved populations in our state, make sure that we're giving all Hoosiers equal access to quality care. I want to impress that. Equal access to quality care. We're going to work with our partners statewide to award grants to communities, build and reinforce their prevention infrastructure, and really support those connections and the work that's going on within our local communities. And then with 80% of individuals in the justice system having a diagnosable substance use disorder, this is ground zero for how we begin to really get at this problem. We're going to continue to fund treatment in our jails and our DOC facilities. We're going to make sure that we're connecting people when they're in jail to treatment and ensuring that connection has a community-based support when they leave. We know we lose so many people, and the risk of overdose when people are exiting the justice system, that is exponentially higher at that point of exit. So a few projects that I'm going to highlight: harm reduction, street outreach teams. This is really about meeting people where we're at. I said earlier, we can't get people into recovery if we can't get them into treatment because they've died from an overdose. So this is really important. This is going out into our communities, ensuring that we're providing harm reduction kits, and that we are talking about treatment. We'll have recovery coaches on these teams that will be working to really hopefully bring people out of the shadows and into treatment. Crisis centers. So some of these have been popping up all across the state, but I'm part of a group that's being led by Justice Goff of the Supreme Court. And this is really looking at mental health in the justice system. But we all know that we can't talk about mental health or addiction in silos. They really are one and the same. And so the Assessment Intervention Center here in Indianapolis, Bloomington has the Stride Center. Kokomo is working on building a facility that's going to be funded in part with some funds from the Lilly Endowment. And these are generally two facilities where someone might stay 2 weeks, become stabilized, and it really allows police a place to take people who don't need to be in jail, whether that's because of mental health or addiction issues. It allows them to divert people right up front to a more appropriate place where they're going to get the services they need to hopefully make them more successful. And during that 2 week stay, while they're stabilizing, they're working on where they're going next. Is it a treatment facility? Is it a psychiatric facility? Really that front door to help provide law enforcement an ability to take someone. We're going to be visiting Arizona this fall. They have a really well organized system there and they have these facilities in all of their, I believe it's their 9 counties that they have. These are probably more regional things. I don't necessarily believe that this is something that every community can sustain, but we definitely want to make sure that every community has access to these types of facilities. Another really exciting thing we're doing is naloxone vending machines. Our goal is to place 19 of these statewide in hospitals, jails, really high need public spaces with 24/7 access. Again, zero barrier to naloxone. It doesn't require you to ask for it. They're really exciting. I think we'll be making an announcement later this month about some of the jails that they're going to be placed in. Supportive housing, just last week, Office of Community and Rural Affairs and FSSA announced a recovery housing pilot. It's now open for applications. You can find that on OCRA's website. This is funding for communities to provide stable transitional housing for individuals who are in recovery. It's a total $1.7 million grants. Total grant funding available is 1.7. And the funding goes towards building or rehabbing facilities to provide temporary supportive housing. This is something that we have really been talking to our federal partners about. When it comes to housing, one of the biggest barriers to funding these is the ability to fund bricks and sticks. We can provide the funding to put programs in, we can fund the bed nights, the per diem, but we really have trouble with that capital. And so working with them to ensure that there's a lot more programs around this. The Indiana Housing Community Development Authority is working on a continuation of a program to fund permanent supportive housing for individuals with co-occurring SUD and mental health issues. And I expect more on this, an announcement later this year. Growing our infrastructure is something that we have been working on through COVID as well. We have 5 new opioid treatment programs. We've continued to expand these. The 5 new locations are Indianapolis, Connorsville, Seymour, Martinsville, and Kokomo. These have served 71 Hoosiers since 71,000 Hoosiers have been served by our OTPs since 2017. And in 2020, 14,436 individuals were served. So huge population that utilizes these programs, and really important that we continue to expand access, that we continue to work on our goal of getting every Hoosier within an hour's drive of one of these facilities. And I believe, yes, our average travel time is now down to 16.5 miles on average. All of this federal funding has a 20% prevention earmark, which is amazing. We are really working towards building up our ability to be able to fund and implement prevention. The Division of Mental Health and Addiction has restructured the way that they are the infrastructure that they have. We have regional coordinators around the state as well. Mobile crisis teams for addiction and mental health. These look a little different in every community. We're going to continue to fund these. Some of these are following up on overdoses. Some of these teams are able to be called to provide mobile treatment. These are really helpful. A lot of these teams are in the northern part of the state and also the southern part. We're really working to figure out how we can expand those into central Indiana and then up and down. Again, we're going to continue to focus on the infrastructure and our systems, ensuring that we're continuing to help support our syringe service programs and our local coordinating councils, and also expanding those programs that we know that work, like our community hospital, the pilot program that they have been or that we have been funding. Challenges. So numbers are up. All of our numbers are up, and they're up in the wrong way. And that is absolutely due to fentanyl. As everyone knows, as little as 0.25 milligrams of fentanyl is a deadly amount. We are finding it in all substances, methamphetamines, cocaines. Our stimulants are having fentanyl laced in them. It is absolutely in our opioids, and it's being pressed into pills as well. So, those individuals who are in active use, it is really important that we are, making sure that they are safely using, that we are ensuring that we're doing everything we can to help keep them alive through naloxone, through our fentanyl testing strips, to ensure that that they are around so that we can move them into treatment and then ultimately recovery. We're continuing to work on stigma, but stigma continues to be an issue, especially as we work in the justice system. And the work that we do in our underserved populations, stigma continues to be an issue. Capacity, we know that our providers are taxed, that everybody is working at limits on this, and a lot of that is really due to workforce. We have a lot of workforce challenges. We have to ensure that we are doing everything we can. So everything from ensuring that we're moving high school kids into pathways for the social sciences, getting them interested at early ages, ensuring that we're creating opportunities for college to be paid for, that we are moving individuals through college as quickly as possible, teaching them to the standards and to the guidelines, providing them the skills they need that they're going to use in the workforce, that we're aligning our licensure to those skills and what our employers need. And that also then around licensure that we're looking at what's the scope of practice and what are the payer sources for those scopes, and then ensuring that we have loan repayment and other reciprocity, so that we can bring in providers from out of state, and especially in Indiana, where we have so many providers that and so many population centers that are on our borders. We have to make sure that there's the ability to work across state lines when Hoosiers need help. So this is something that Pew has been helping us. The Pew Charitable Trust has been helping us. The Bowen Center at IU, the Behavioral Health Commission, the Children's Commission is working on this as well. All taking little pieces, because there is no one silver bullet for our workforce problems. We have got to continue to work on this at each and every level, because there is no one thing is going to provide us with enough behavioral health technicians for the future. And this is a long-term problem that we have to work on. And again, housing and transportation always, continue to be problems that we're continuing to work on. So again, I want to thank you for your time today, for your efforts in strengthening relationships and building bridges across your communities, because really only together can we make Indiana a better place for all Hoosiers. So thank you again for the time, and I think I have left enough time to address your questions, so happy to take them.
Thank you, Doug. Does anyone have any questions for him? All right. I'm making sure there's nothing in the chat. Okay. All right. Well, thank you very much. That was very, very informative. Right at this point in time, we'd like to turn it over to the ICJI team to see if they would like to provide any updates.
Perfect.
Corey.
Hey, everybody. Hope everyone's doing well. Again, I appreciate you all being on this. It's a very valuable thing that has been created here, and everything that you folks are doing to keep it going. It's great. So just real quick, just wanted to give you a quick update. This morning, you all should have received a newsletter. We basically, I'm sorry, I had notes and I just lost sight of what I was reading. All right, this morning, so we distribute our quarterly LCC newsletter to you all, which this provides LCCs with updates from ICJI, some digital resources, and information on how to improve the comprehensive community plan. So each newsletter that we have, it contains information on how to improve certain sections of the CCP. So the previous newsletter that we'd sent out a few months ago, that one focused on SMART goal improvement. The newsletter that we sent out this morning, it provides information on the fund document. I know there's been some questions about that and some of the wording on that. So I hope this provides some clarity for you all. In the next newsletter that we'll have in December, that will cover information regarding data sets and their connection to problem statements. Because we noticed there's been, on the last 2 years of reviewing these new CCPs, there's been some disconnect between data and problem statements. So we really want to make sure those are well connected so you have a strong CCP. Next thing, the quarterly report. I sent out an announcement this morning through email that the second quarter report is due on October 15th, and that must be submitted in IntelliGrants. That will open, the window for submitting that will open on October 1st. If you have any questions about the quarterly report, please contact myself or Sadia, and we will do our best to work our way through that, okay? The annual review of the LCC Policies and Procedures Manual is nearing completion. Really, we're just one section that we have to brush up on and make sure everything looks sound, and then we'll send that off to our communications director. We'll put it all together in a nice little format, and then we will distribute that out to all of you, hopefully mid-November. Also, the ICJI LCC advisory group actually met, I think maybe it was yesterday. I can't remember. This week has just flown by. So very excited about that. That is just a group of coordinators from across the state, from counties that are large counties to counties that are smaller counties. Really, just the purpose of the group is to help guide our decision-making process and to enhance the coordination of LCCs across the state of Indiana. So the next meeting for that, I think, will be in February. I think we're going to send out some information on who's actually on that advisory group. So if you have any information maybe that you want them to bring up with us, you can reach out to them and contact them and let them know. So also we're going to still continue having our meetings with LCC coordinators. So we're going to schedule those one-on-one virtual meetings for the 2021 CCP year. So be on the lookout for us contacting you, and hopefully we can arrange some sort of meeting time where we can discuss how to improve the CCP, the end of year reports that we had for you all, and also any reporting requirements or any other questions that you may have. So that is all that I have. If you have any questions or concerns, just reach out to Sadia or myself, and yeah, we'll help you walk through those questions with some answers. Okay.
Thank you, Corey. All right. Jody, do you want to provide any updates on Recovery Month and what's going on? I know there's so much going on.
Yes, there's been a lot of events already happening. There's some more events going on this weekend. You can visit the IndianaRecoveryNetwork.org website and go to the events page to find out all of the events going on throughout the state. So check your area and come out and join us.
Thank you. All right. And then I'm going to do a plug for the Indiana Coalitions Network, and making sure that you are onboarded into the coalition, and so that you can have access to all the webinars and all the chat groups and information. So if you have not done that, please get onboarded. You can reach out to the on the website, or you can reach out to Jody, myself, Bobby, or Ali about that. Also, if you have any drug-free communities grants or participants that are not part of your LCC, they are invited to attend and be part of this wonderful group also. We, as you can tell, just from today, we get so much information and learn so much about what's going on across our wonderful state. Another plug to remember that Wednesday, November 17th, we will be holding our meeting, our webinar, rather than the third or the fourth Thursday, because that's Thanksgiving, and hope you're enjoying your family and friends as we will be. And the same in December, it is moved to Wednesday, December 15th. So just kind of put those on your calendar so you can remember. But otherwise, we will see everybody next month. But right now, if you would like to just network and chat with others, please stay on and do so. Or otherwise, have a great rest of your day.
If you don't mind, I have a really quick, unrelated update to the LCCs that I just wanted to make everyone aware of. Sorry,
All right.
my camera is appearing sideways, or I'd show up for everybody. So just as a reference, and I've mentioned this to you all before, I also oversee our youth division, which undertakes Title II related efforts to the Office of Juvenile Justice and Delinquency Prevention. We just released our RFP, our request for plan for our Title II dollars. And this RFP opened on September 15th and will remain open through October 15th. I will send it to Corey later this afternoon to make sure that it comes out via the CJI behavioral health email. But just so you know, this covers nonprofit schools and state and local agencies are eligible for funding. It does have a 10% match requirement. Our core areas this year are looking at juvenile justice related items in relation to compliance monitoring, delinquency prevention, indigent defense, juvenile justice system improvement, mental health services for youth in custody, mentoring, counseling, and training programs, racial and ethnic disparities, and then substance and alcohol abuse. So that last category in particular is most likely of interest to everybody. The focus for youth for OJJDP is 28 years of age and under. But obviously, when you think about Indiana's juvenile justice system, it's going to align to how juveniles are viewed in our system. So I'll have Corey send that out, and thanks for allowing me to provide that additional information.
Thank you very much, Michael. All right, now I'm
I sent an email to the network to connect for those resources and information updates. I just sent it in.
Okay. All right.
Thank you.
Thank you.
If we need more information on the Regional Recovery Hub project, who can we contact?
Heather Rodriguez.
Yeah.
Let's see. I believe her email is in the chat. Around 12:12, it was entered in there. Do you have access to that, Heidi?
Yes, I will
And
go
Heidi,
back and look.
Heidi, Michael at ICJI. If you don't get a response there, we're in regular communication with Brandon. So if you reach out to Corey or Sadia and ask them, or just email the CGI behavioral health email, we can also facilitate that connection if you need that.
Okay, great. Thank you.
Also, I'm actually with the Indiana Addiction Issues Coalition, which is part of Indiana Recovery Network. So you can feel free to reach out to me and I can make some connections so you can get connected in your area if that's what you're wanting to do with the hub in your area.
Yes, yep. Because I'm not sure how connected anyone in my county is to this, and I would love to try to make some of those connections.
I would be more than happy to help make that connection for you. If you
Yeah,
want to.
I just looked at the map and it looks like Oak Lawn.
Yeah, there is a map on the Indiana Recovery Network, if you click on the main image on the homepage, it goes to the Recovery Hubs page, which will show you the map, and it will tell you which ones are your hubs depending on your county.
And you can go into that hub and get that contact information from the Indiana Recovery Network.
Okay, from the map.
Website. Yeah.
Great, thank you.
But we would be more than happy to make a connection for you too. So.
Okay, yep, I would love that. Thank you.
Kimberly from Scott County, are you still on here? I just wanted to, she's not, okay. I just wondered, I think she was in
Oh no, she's still on. She's still on. I'm sorry.
Yeah. She was on in a craft training with me, I think, and I just wanted to let her know we're kicking off our craft program again tonight, which actually Becky Calhoun, who's still on here, helped set up and organize.
There's a connection connections are being established.
Hi, Becky. How are you?
I'm good. I apologize. I had 2 meetings going at one time, literally in that meeting going, ooh, let me tell you what I'm seeing on the screen over here.
That's great.
It's real time.
It's real time.
Yeah. Yeah. I need to get up there and see you. I have a mug for you.
Oh.
From
cool.
ICN. Yeah.
When you going to come visit me?
I don't know. I'm hoping soon. Are the leaves changing up there yet?
Starting to.
Are they?
We're bringing David Parnell back the last part of October. You can come up when we have our community night with him.
Yeah, that would be good. What's the date on that?
I don't know at the moment. It's the last week in October, and I'd have to look to see where he's at, which date. I don't know at the moment.
Okay, no problem. Yeah, make sure you send it to us because we could even put it on the coalition stuff too. On the website, and see if people can click on it and we can promote it. So
sounds great.
All right, wonderful. Okay. Anybody else for anything?
Okay, there's a question here from Antonia. Can I get on the email list? Yeah, if you send us if you go to the site, there's a contact list. There's a contact us. If you fill it, give us your information and we will get you added. Antonia.
That's a pretty name.